Dr. Abu Khair, our fellow.
Yes.
As you know, I'm a thoracic surgeon, a chest surgeon. I'm seeing you because of this spot between the bifurcation of your windpipe. It's called the subcarinal space. The carina is the bifurcation of the right and left windpipe. And you have a mass there, and they biopsied it, and it's for sure cancer. So then we're left scratching our head, where did this cancer come from? So we did an MRI of the brain, and the brain looks clean. And then we did a PET scan, and the PET scan doesn't light up anywhere except for that spot. And usually cancers don't only start in that spot. That spot is a place where cancer travel to propagate to, go to, metastasize to. So by definition, theoretically, it has to be coming from somewhere else. We can't find it with imaging. And then we did an endoscopy and we looked down your throat, Dr. Dam did that, and it doesn't seem like it's coming from anywhere from the esophagus or stomach, which is good. Could it be coming from elsewhere? By definition, yes, but we just can't find it. The good news on the ultrasound that Dr. Dam did, it's not attached to the esophagus. So that means from a technical standpoint, it's much easier to remove it, much smaller surgery. It's about an hour and a half of surgery. You're in the hospital usually overnight.
Yeah.
But then the bigger issue becomes how to treat this. If this is a cancer that theoretically came from somewhere else to that area, we'll be able to maybe get more information when they do more in-depth analysis of the tumor, because now we're not just taking a few cells to give us an answer. Now we're actually going to be removing it all completely. And we may be able to find out where it originated from, but more importantly, we're also going to look for any genetic mutations that are on it to tell us how to treat it.
Yeah.
If it came from somewhere else, that means that it's theoretically in the bloodstream. That means you need cancer medication in the bloodstream. Cancer medication in the bloodstream is called chemotherapy. There's also a new type of medication in the bloodstream called immunotherapy, which are injections to boost your immune system to fight the cancer. So you would definitely need some type of systemic therapy, some type of therapy that goes through your whole system, your whole body. And for it to go through your whole system, your whole body, you have to give it through the bloodstream. Chemotherapy and or immunotherapy. But first, let's get it out, analyze it. It's part of the treatment to get out the cancer that we can see. It's localized, which is good to that area. It's not invading the esophagus. So how do we do this? You come in the morning, we put you to sleep. It's general anesthesia. I make 4 little cuts like this between the right ribs. I go in there with a 3D camera, long, thin instruments, which are wristed. I go in there and I remove that piece in one en bloc, meaning in one piece. The surgery itself takes about an hour and a half. When you wake up, you have a little drain, slightly smaller than my pinky, called a Blake drain, and it usually stays overnight. Very important after the surgery to get up and walk and do your breathing exercises to avoid a pneumonia. Pneumonia is the most common complication after chest surgery, and the best way to avoid it is by getting up and walking. Another risk is whenever we remove lymph nodes in the area, there's a little duct called the thoracic duct that runs in that area. So sometimes we can cut some of the branches of that duct, and then it can leak chyle. It's not life-threatening or anything. Chyle is basically whenever we eat fat, our body absorbs the fat through this little duct. And sometimes as we cut in this, and that duct runs in that area. So sometimes as we work and remove lymph nodes, then we can injure that. The likelihood of that, I would say, is less than 1%, but it's not 0. If that happens, we usually have to keep you on a no-fat diet or keep you from eating, and we give you food through an IV for a few days and give you medications and it comes back to normal. But the likelihood of that is less than 1%. Other risks are risk of an abnormal heart rhythm, called atrial fibrillation, not a heart attack, but rather irritation of the heart leading to an abnormal heart rhythm. In this type of surgery, I would say it's about 2%, very low, because we're not dividing any lung parenchyma and you have no emphysema. always a risk of a heart attack or stroke. You've never had one, so I don't think you will, but legally I have to tell you these things can happen. And lastly, I have to scare you and tell you there's a risk of dying from the surgery. Risk of dying from the surgery is way less than 1%, but it's not zero. Surgery is only part of the treatment. The other major part is the systemic therapy.
Of which we won't know what that's gonna be until we know what kind of cancer it is.
Correct.
Is it possible that this has been metastasized from his thyroid cancer that he had?
It could be. It's unlikely, but yes.
Oh.
Remind me what other cancers you had. Thyroid
Thyroid and skin,
and skin, yes.
squamous and basal.
Yeah. Skin is extremely weird for it to go to that area from the skin and nowhere else. Thyroid, possible. But skin,
Okay.
I'd be extremely surprised.
So if it did come from the thyroid cancer, or if it did come from some other area, will we know what other area it comes from?
Not necessarily.
Okay.
Well, we're hoping to.
Yeah.
But we may not get enough clues from looking at it. And then we just need to treat it with chemotherapy. Then what would they do, and again, that's a medical oncologist, not a surgeon, not me, but a medical oncologist then looks at what's statistically the highest suspects on our list. And we give chemotherapy that will target all those suspect locations.
And he determines how much chemo.
Yeah, now do you have an oncologist?
No.
No. And where do you live?
Bradenson,
Okay. So do you want to come back here to be treated?
yes.
Yeah, so I'll get you with a medical oncologist here.
Okay. So,
Restrictions afterwards. We talked
Yeah.
about it.
Yeah, no, you can start going in a pool probably a week after the surgery, but you can start driving a week after the surgery and slowly go back to all your activities.
So 2 weeks off and I can start riding my bicycle again. Huh?
Yeah, I mean, you may have some discomfort, I'm not gonna, lie to you, but yes, you can ride your bicycle shorter distances, see how you feel.
okay, good. So, I don't understand cancer, but if it has metastasized from somewhere else, which is what we think it has, right?
Correct.
Does that mean that it's less likely to be cured?
Correct. That doesn't mean it's not likely to be cured,
It's less likely.
less likely to be cured,
Okay,
but not likely.
okay,
We still have hope. We have a lot of hope. Can I guarantee? Absolutely not. Did I wish it was primary lung cancer or it was just a nodule in the lung?
yeah,
Stage 1, yes. That has a better prognosis than if it shows up in a lymph node. But that's what we're facing.
right, it is what
And
it
we're gonna
is.
take care of it.
Yeah,
And we're gonna be optimistic and we're gonna try everything we can, fight a good fight, and I think we're gonna win.
yeah.
But would have been an easier fight if it was a stage 1 lung
Yes,
cancer? Yeah.
yes. Do we
But that's
know a
not what we
stage?
have.
Do we know a stage at this point?
No, because we have too many unknowns right
Okay.
now.
Okay, when you gonna do it, Doc?
When would you like to do it? Earlier, later, October, September?
Earlier,
Okay, fine.
I'm going on a cruise Friday.
When?
this weekend.
After that, I'm back on
August, today is September 6th, right? So you're on a cruise when?
From the 8th till the 12th.
Oh, it's only 4 days.
Yeah.
Oh, you're going on Carnival to?
Yeah,
Just with our
Royal
grandkids.
Caribbean with
Oh,
the-
yeah.
Yeah, just
Oh,
to-
Royal Caribbean? From here?
Out of
Tampa.
Done.
Royal Caribbean goes 4 days only? Oh. Okay.
So-
How about the week after?
Whatever works for you.
Okay. So my nurse Kevin's gonna come in, get you to sign all the paperwork, and then my schedule will go over possible dates for you after the 18th, or the week of the 18th and onwards.
Okay. Actually, we can even do it, 18th and onwards, fine.
All right, very good.
And we will get an oncology appointment too, or?
Yes, but after the surgery, not
Okay,
before,
so not
right?
yet.
'Cause we need
Okay.
And
All
we
right.
anticipate that biopsies will take
about 10 days,
10 days.
because they have to do more in-depth analysis.
Okay.
Right,
All right.
Okay?
All right.
okay.
Very nice to
I
meet
feel
you.
like we're in good hands.
Thank you, thank you. We will take good care of them.
Okay,
Don't go anywhere. Kevin will be in my nurse.
Okay.
okay.